We're here with Dr. Jeff with Hillside Chiropractic in Elk River, and today I want to talk with you about lower back pain and help us understand lower back pain specifically for people that constantly use their muscles correctly or incorrectly, how you address the lower back pain and what are the things you use to make sure that they just don't get in this vicious cycle of always getting adjusted and going immediately back to the same pain a couple days later.
Well, our technique is much different than most people's technique. What we do here is we focus on getting rid of the problem by addressing all the things that lead to the problem. It's not just, okay, you have a pain here, we're going to give you a pain reliever for that, or I'm just going to adjust that spot. Like for instance, the low back, okay, so you have pain right here. Obviously we're going to be adjusting that area, checking it out, make sure it's moving right. And we're going to do the muscle work in that corresponding area throughout there, whatever we find is tight. But not only that, is we're going to work in the glute muscles here in the back, make sure the hip rotators are working properly. We're going to work the quad muscles to make sure that's going all right. Check out the hamstrings, make sure that each side of the leg's working properly, the abductors and adductors in here and too, and making sure that's all working right too, because if you have tight muscles, any one of those areas, it can affect the way you walk. And when you affect the way you walk, it's going to put a lot of stress on the pelvis and the low back. And most people that have problems in those areas are really surprised at how much work we do outside of the area that hurts. But that's the most important part, is making sure everything else around there is moving right so it doesn't cause problems in the future and you can actually get some lasting relief and be active. You know, if you're trying to be active with some of those tight muscles, you can be right back where you were, you know, within a week if you're not addressing the real problem.
Okay, well, that makes sense. I work out, and I know that sometimes I focus on things that I too much, some I shouldn't focus on. So you're telling me that you're gonna find range of motion from a secondary standpoint versus what I think my range of motion is to help me get stronger and get better. Is that correct?
Right.
Okay.
Overuse leads to scar tissue, and scar tissue leads to shortened muscles, reduced range of motion, and problems. And by breaking up that scar tissue with the active release technique, we can get the function back into those muscles and get everything working the way it is supposed to be working. And people, you hear it almost every patient all day long saying, I didn't know I hurt there. Because if you can't sense every spot that hurts, if you did, you'd have a tough time making it through the day. But when you start working muscles in there, you can find out that this was a problem that was going back, you know, probably years before you actually felt the pain, because some of that scar tissue is really deep, really dense, and it's been a problem for a long time. And without breaking that up, you're not going to get any really significant lasting relief.